Hi everyone, welcome back. In today's video, we are going to be diving into a very crucial topic for every dietitian, which is nutritional assessment and screening. This is the very first step that every nutritionist takes in identifying the individuals that are at risk of malnutrition, and this therefore helps them give those patients an effective and best care. The whole process about nutritional screening and assessment is the same as the process of winnowing. This is whereby you are able to remove the chaff from the good cereals, and that's technically what we are doing by conducting a nutritional assessment and screening. Nutritional screening is a quick process of identifying the individuals who are at risk of malnutrition. Once someone is identified as at risk, we move to the next step, which is nutritional assessment. This is a more comprehensive process where we dig deeper into the nutritional status using the ABCD approach. ABCD is an acronym that is used to stand for anthropometrics, biochemical, clinical, and dietary assessment. In the anthropometric assessment, we are going to be assessing things like weight, height, BMI, MWAC, among others. For the biochemical assessment, we are majorly working with the lab works and the lab results. And learners, there are key lab results or lab works that are crucial or are needed by a nutritionist. These are things like the glucose, the albumin, calcium, iron levels, among others. For the clinical assessment, we are majorly working with the things that you're seeing, you're able to physically see. For example, when a patient is presented with edema or dried skin, you can be able to say that this patient is dehydrated. For the dietary assessment, in this case, we are going to be assessing the dietary needs and also the dietary or whatever this patient has been consuming. It could be daily, it could be weekly, it could be monthly, it could be even yearly. And for this assessment, we use tools like food frequency questionnaires. We've used things like 24-hour recall. We use even things like food diaries. From these tools, we are able to come up with a conclusion if this person is food secure or is even food insecure. So throughout this model, you're going to learn how to conduct these steps in details, one by one. After conducting this assessment, you're able to come up with your findings. And these findings, you're going to use them to conduct to come up with an intervention, which is going to be a detailed nutrition care plan, whereby you start with the assessment, you come up with a nutritional diagnosis if this person is sick or not. And once you've come up with a diagnosis that yes, this person is sick, you come up with an intervention or a work or a plan that you're going to use to curb this malnutrition. Upon coming up with that plan, you should take your client or patient through the plan, ensuring that they understand what they are expected to do. After doing that, you can discharge the person and do a follow-up, whereby they're supposed to come back to the hospital and you ensure that your goal has been met. So learners, by the end of this module or by the end of this topic, I expect you to be able to do a very detailed nutritional screening and a thorough nutritional assessment, come up with interventions and a detailed care plan. Let's get started.